a district governmental agency. Our board is required to call our meeting to order, and I'll ask that Fred call roll call, please.
Brad Waite.
Here.
Bill Thompson. Here. Fred DeWitt. I'm here. Dean Matthews. Here. Gayla Pock. Jay Harrell. Here. Rob Dobry. Here. And our attorney, Keenan Lovett. Here. You're hiding down there.
Are there any changes or additions to the agenda? Hearing none, I want to thank everyone for coming tonight. I wanted to give you a quick update for MCHD. Our board has approved the application for a Tier 1 design, the design piece of the DOLA grant for the amount of $200,000. And that design work is to address the facilities infrastructure and equipment, upgrades and replacement. And that is being written by Chris Burkett, who we've put on as our person to write the grant, and that is due on Monday. So we're excited about submitting that. And with that, I'm going to turn it over to Tom Rice, Chair of SHS.
Good evening, everybody. It's 6:03, and I'd like to call the Southwest Health Systems meeting to order. First of all, I appreciate everybody joining us today. One of the things that we've discussed and gotten feedback from the community is to have more open forums and joint meetings, and so this is our quarterly meeting, our quarterly joint meeting. We discussed doing it monthly. However, we felt as though it would be more productive for all board members and the public to do it quarterly. If we find in the future we need to do it more often, we'll certainly consider that. But again, thank you very much for joining us tonight. I know the hospital is very important to the community, and appreciate everyone's interest in the operations of the hospital, successful operations of the hospital. Tonight, our agenda includes our general report from the Montezuma County Health District, a report from the Community Health Corporation on the management of the hospital. We'll be discussing our financials, as well as a variety of other issues that we're trying to deal with tonight, including some infrastructure issues within the hospital itself, some committee issues that we're, some committee positions that we're trying to fill, as well as a number of other issues, including some support for MCHD's DOLA grant. But first, we would like to start out with public comments. Typically, we try and keep it to 3 minutes. However, I think everybody's comments are very, very important. So we ask that you keep it to 3 minutes as best you can, but we'll try and accommodate everyone. What we'd like to have you do is step up to the podium over here, tell us your name if you're willing to, and then ask your questions. I do know that we are being streamed by the city of Cortez's closed caption TV. We appreciate the city offering up this beautiful facility for tonight's meeting, as well as letting us hold our meeting here and airing it on closed caption TV. So I'd like to turn it over to any public comments at this point. That was one. That was under 3 minutes, and that was a good point. Yeah. Okay, well, if there are no comments, I would like to hand it off to Brad for the MCHD report. And then, Brad, are you going to call your meeting, adjourn your meeting after this, or? Yes, we'll okay. Adjourn, and yeah. I think you're going to start. Oh, I'm sorry. Yeah. Yeah. Go ahead. I'm sorry.
I was actually going to do this, just briefly go through this update from.
That's fine.
From this, since we had the last. Oh, I'm sorry. There we go. It says right there, green line. Okay. Yeah. Obviously, it's been several months since we had the last forum, and a lot has changed. A lot has happened since then. So we wanted to go through just a little bit of update to bring you up to date on some of the changes that had happened, and show you a little bit about what we actually do as an organization. I'm not sure that everybody truly understands the total impact this organization has on the community, but this is just an example of the services that we provided during 2018. It shows you the number of people we actually touched during the year. 1,200 admissions, almost 13,000 ER visits, a little over 47,000 clinic visits, 1,200 surgeries. I won't go down and read all the lists, but just wanted to let you know exactly some of those volumes. Obviously, we're doing a lot as an organization. And overall, basically what this means is that we have over 100,000 patient encounters every year to the people in this community. Obviously, we have a very significant labor force here. We have about $23 million in total payroll. That was after the reduction to force last year. It's calculated that has a local economic impact of over $44 million to the area. Obviously, our finances have been a very significant topic of conversation over the last few years, and I want to show some of the progress that we've actually made to this point. You know, if you look at the trend back from 2014 forward, we had a couple good years up to 2016 and really fell off in 2017, where we had a bottom line of a negative $4.5 million. The reality is looks like what happened is we ended up writing off a lot of the revenue that was recognized during 2016 through in 2017. So basically, it kind of leads me to believe that probably 2016 wasn't quite as good as we first thought it was, and probably 2017, based on itself, wasn't quite as bad as it was, but still not where it needed to be. 2018, we ended up with a bottom line after taking out some prior year adjustments of a negative $1.3 million. Obviously, a substantial improvement over where we ended in 2017, and showed that we actually did make some progress on the changes that we made during the year. We also saw significant improvement in our cash during the year. As we said before, we were down to 15 days cash at one point back in March of 18. We showed that increasing up at the end of the year. We're at 32.7 days. We continue to see pretty steady increase of that through this year. Our target, based on our forbearance agreement that we reached, we had to be at 45 days by June 30th and 50 days by the end of 2019. We're actually trending well ahead of that at this point, so we feel very confident we're going to stay on target from where we need to be from the cash standpoint. Like I said, things are looking much better. We've already implemented over $8.4 million in annual expense reductions through the reduction in staff we had, reducing contract labor, renegotiating a lot of our contracts, and making adjustments to our benefits. At the same time, we've been able to maintain those reductions that we experienced during the reduction in force. We started 2018 with 461 total employees. As of last week, we had 399. And you can see that the day of our RIF was highlighted in red. At that point, we actually had 399 employees. There's a few more actually left a little bit later, as there was some, we had to wait on some before we actually were able to terminate those particular positions. But we still have maintained that reduction and continue to do so as we move forward. Something worth noting is one thing we said, that as those persons that were included in that RIF, as positions came open, we would look to them first to rehire. We actually did rehire 17 of the people that were included in those 40 that were RIFed back in August. Subsequently, 4 of those have also left since that time, but we have continued to look at that as we move forward to make sure those positions were looked at first, or those persons were looked at first when we refilled positions. Something very significant, if you look at the first 6 months of 2018, the bottom line loss was $2.5 million. If you look at the last 6 months of the year, it was actually $1.2 million to the positive. So we had a $3.7 million improvement from July to December versus the first 6 months of the year. Now, looking forward to 2019, what are we really looking to do? Obviously, maintain our current operational improvement. It's a big goal for us. Improve access to family practice, internal medicine physicians, and orthopedic surgery. We have a new physician coming on in July. Susan Lanningham, an internal medicine physician, will be starting then. Melissa Sims, a nurse practitioner, starts in June. Dr. Kenneth Ness, internal medicine physician that is working in our hospitalist program, actually started this month. And obviously, a big topic of discussion last time was Dr. Baggy, and we did complete the contract renegotiate with him, and he's still on board with SMG. Other goals that we have, get the word out. Currently, 40% of our medical care provided to Montezuma County residents is provided outside the county. So we see that as a major opportunity for the organization, continue to get those people back into the system. So we're looking on increasing marketing to really make people aware, bring people into the facility. We had a donor appreciation open house a couple weeks ago that had over 150 people in attendance. We've been hosting educational sessions. We had one on pediatric sleep apnea that was sponsored by the University of Colorado and Children's Hospital Colorado, which had attendance from medical professionals from all over the Four Corners areas. Other things we're working on, increase the utilization of our Women's Center. We have top-notch physicians, top-notch facilities, and we really need to make the people around here aware of really what we have. We're looking at expanding our sleep program, expanding general surgery to 24/7 coverage, and last but certainly not least, improve the culture to assure patient-first attitude throughout the organization. Staff and physician education on improving patient satisfaction, and the process improvement within the organization to ensure that all patients have excellent experiences. That's some of our goals there. So, like I said, just generally wanted to run through that quickly, let you know what we've been doing, where we were as an organization, and we'll take it from there.
Thanks, Tony. And I just wanted to highlight that the donor appreciation evening, that brought a number of people from the community to the hospital, and it truly was a good opportunity to celebrate that new facility. And we certainly thanked the people who made some donations to the hospital, as well as certainly the taxpayers who are helping with this who helped fund this expansion. But I also wanted to make sure that everybody knew that the employees of the hospital were sort of the core behind the success of the hospital, and we're going to support this new addition to the hospital. So we do appreciate the staff of SHS and all they've done to make the hospital a success. So it couldn't be done without the staff that devotes a tremendous amount of time and energy to the program. So we can hand it over to Brad, unless there was something else.
Nope.
Nope. I think that was it.
At our last regular board meeting held on March 13th, the biggest item that we talked about, of course, was our DOLA grant and updating everyone on that, making a decision to go forward with that. It is a matching grant, so we will match the other part of the total amount of the design. 200,000 of that we are applying through DOLA. The total could run between 520 and 550. Is that correct, Dean? Yeah. Okay. We approved our final 2019 budget, and that really, we had a pretty short meeting, and so that's unusual for us. That was good. I think those are the main items. Thank you.
All right, Brad, thank you. I'd like to hand it over to Craig Sims with Community Hospital Corporation, who's going to give us an update on the Management Action Plan update. Thanks, Craig. Any questions from either the Health District or from SHS Board for Craig? Okay. Okay, I'd like to hand it over to back to Tony for some updates.
Okay, our CFO, Rick Schrader, has actually had to return to Florida. His wife had emergency surgery last night, so I'm going to do the financial report for him this month. We're talking about February. Actually, another good month. Strong revenues exceeded the prior year about $200,000. Net revenue basis, actually almost over $500,000 additional net revenue for the organization. Our expenses were up, but primarily due to the fact that we had additional depreciation as a result of the opening of the new building and that construction. So we ended up with a bottom line of the month for about $70,805 compared to prior year loss of $160,000. So right at a $230,000 improvement for the month. This coming off an extremely good January that we had, where we had a very significant bottom line. For year to date now, we're sitting at a bottom line of revenue expenses of $846,000 compared to last year, where we're at about a $1.2 million loss. So we have about a $2 million improvement from where we finished up with February last year. We continue to see good improvement in our cash. We were at, ended up last month at about 30, I think it was about 37 days. I think we're going to see some additional improvement on that. For this month, we should be probably better than 40 in our days cash. So we continue to see that improve. We've seen our accounts payable go down. So we're seeing improvement there. We were down about $600,000 on our total accounts payable. We have our accounts payable at about 45 days, which is about where we want to keep that. So we've got that in line with where it needs to be. And like I said, all things keep progressing very well from an organizational standpoint, from the finances. Any questions?
I just want everybody to know that our finance committee met last Thursday to go over some of these financials, and we discussed them a little more in depth at those financial meetings on Thursday morning. And we'll entertain I think we can do that right now, actually. I think we can entertain a motion to approve February's financials. The financial committee, which consists of Dan Valverde and Shirley Jones, met on, like I said, on Thursday and recommended for approval those minutes. But before we move on, are there any questions? I know the financials are quite in depth. Does the public have any questions about the financials at all? I know it's hard to digest it in a matter of minutes. Yes.
So after it's been how many months, Tony, since we came on board, CHC came on board?
Mm-hmm.
So after your system analysis, where was the money going? Where was the lack of oversight? In your assessment, CHC?
Sure.
Can you answer that?
Yeah, a couple of things as we address, the operations, assessment before.
Craig, can you turn a microphone on? Yeah, thank you.
Really, there was a number of issues that we found. First of all, as you can see from the financials, your expenses were higher than your revenue. It's not just says in your own bank account. You had more expenses than you were able to pay. And so that's part of what we had to reassess. And the reduction in workforce, because about 50% of your operating expenses is in salary, wages, and benefits. You were running as high as 75%. That's not sustainable. So that was obviously a big issue in that regard. You had issues with the billing services. Again, getting a bill out, getting paid in the timely manner, getting a clean bill out. We continue to work on that, improve on that. So when Tony talks about cash flow and seeing more cash coming in because we're able to get a bill out and get paid by the government or other agencies in a timely manner. We're asking the doctors to do some things differently as well, quite frankly. They're based on a productivity
Heather, is that what you wanted to hear? Or no, I'm not saying is that what you wanted to hear, but did that answer your question?
Yeah, I was asking on behalf of others.
Okay.
Still a lot of work to be done, and still a lot of hard issues, and although we're pleased with the financials and where they're progressing, we're not out of the woods. I would tell this community that, again, this is a viable hospital, and we are honored to be a part of working through this with you. Our goal, our mission is the mission of this hospital to remain viable. We're pleased with the results, we're pleased with the leadership team, your next progress.
Legislative attempt. Oh man, I missed that.
So you have the same legal counsel that had no oversight when you got into this, and you have the same legal counsel now.
I have different legal counsel. I'm not represented. CHC is not represented by that counsel, by any counsel here. Yes, sir.
Can you share their 2018 projections?
The 2019 projections on that, I'll turn that over to Tony.
What do you expect in the year?
We have a bottom line budgeted of $6.7 million. So it's right at about an $8 million improvement over where we ended up last year.
Okay, where's that putting cash on hand?
Our goal, our target is to have 50 days cash on hand by the end of the year, and we're well on target to hit that. So.
Well done so far.
We're moving in the right direction, but, again, we continue to see pressures on reimbursement, continue to see pressures. This week, you may know, the Department of Justice ruled that the Affordable Care Act could be completely unconstitutional. That would have a major disruption in our business. So there's always challenges, there, but you're moving in the right direction. But, we can't afford any type of slip. Right. The banks are holding us as well.
Craig, I don't know if you followed the Colorado State Legislature's attempts or activities that could impact rural health care, and I don't know if you could expand on that at all.
I do a little bit, Tom. I'm probably not well versed in that. I'm happy to come back and share that with it. But there's been a lot of movement across the country in rural health. Texas, where our hospital, we lead the nation in the number of hospitals that have closed over the last number of years. And the hospitals or the states that have not expanded with the Affordable Care Act have the highest percentages. I was just in Kansas earlier this week, and they're right up there as well. So there's a lot of effort by the legislators, both at the state and at the federal level, to see what we can do to preserve rural health care. It represents about 20% of the total population of the country, and it's an important component of any of the towns there. But there's a lot of movement there. I don't know to the details of what you're referencing, Tom. I'm happy to answer.
Yeah, I actually give you a little bit of insight on what I know about what's going on. And you've probably heard, Governor Polis has made it a priority to look at reducing healthcare costs in the state of Colorado. Very legitimate. If you look at nationwide, the western slope of Colorado has some of the highest insurance premiums in the country. And so there obviously it is a big issue. So he's made it reducing healthcare costs a priority. Right now, there are 40-plus bills pending in the Colorado legislature that could directly or adversely affect hospitals and healthcare providers. One of the things that we're really working with the Colorado Hospital Association and the Western Health Alliance on is to make sure that as they look through these bills, they truly understand the difference between the effect on urban providers and rural providers. A lot of what we're hearing is that, they're basing a lot of their assumptions on what's happening around Denver. They're seeing all the construction, all the mergers, the healthy bottom lines that's going on. And our concern is that they're going to look at that and say, okay, well, rural health providers can be affected the same way. Obviously, with our circumstances, not really that unusual or that different than what we're seeing throughout the state. Rural health providers are struggling. We have very thin margins. We'll continue to have thin margins. We have some major capital needs, and I don't think we're that unique in those types of things. So what we're working on is to make sure that as the legislature looks at these bills, there is some protection for rural providers out there, and it needs to be a real high priority to make sure that that happens, because as I said, we're doing well right now. We take a major hit in our reimbursement, that could turn things back around very quickly, and it's something we want to avoid at all costs at this point. So.
Thanks, Craig. Thanks, Tony. Any other questions? Yes?
Tom, I know there's been some change in who's on the board, and just even recently, so it might be nice just to update currently who's on the SHS board, and if there's still board openings, maybe you could review that for everyone.
You bet, yes. Well, there's always been board openings ever since I joined the board, and even before that, we've always had room for more people to join us. Recently, Terry Cook stepped down after, I think, 7 years on the board. He was one of the major players behind the successful, 4 years on the board. Felt like 7. He was one of the successes behind the addition being built there. And then Steve Fusco, who was on the board, for, I believe, 7 or 8 years, stepped down too. He was planning on stepping down after construction was completed. So that means that we now have Shirley Jones on our board. She joined us in December. Dan Valverde joined us last year too, after he had been on the board for how many years prior? 2.5 years. Left and returned. Cody Burke, who is joined us in December, is one of our board members, and then of course I'm the 4th board member. We have been trying to recruit people. We've had some interest via our online registration program that we have on our website. I've sent out a couple of packages to two interested candidates. Have not heard back from them. We would like to recruit. We have some other ideas about some areas that we think we need to recruit, where we could have the help of some locals that may have some good financial sense that could be in addition to the board. And of course, we're looking in our community for people who are interested. Our bylaws allow 2 employees of the hospital to be on the board, and so that's our board situation. It's as you all know, this is a difficult time to join a board, a difficult time to join this board. It's a big challenge, but I think between the health district and the SHS board, we have people who are committed to the success of this board. And we certainly would take new energy to help out. So.
Does Cody count as one of the 2?
As a contract, as a contractor to the hospital, he does not qualify as one of those hospital employees. So we still have room for 2 folks from the hospital. So, and if you're interested, you can contact me or any board member, or you can go on to the Southwest Health Systems website, and there's a link for that as well. So we would take good help. So, okay, yes.
Why employees are to me, it seems like a complete comment.
That's a good point.
Especially if you have to make a decision on appointment that employees are accused.
It does put people in a difficult situation. One of the rationale behind that is that when you have a small community with a limited bench of people who know about healthcare, we have to reach out to those people who have expertise in local healthcare. I don't think anyone can argue that it puts an employee / board member in a tight spot. And so it does take somebody with thicker skin, as well as a desire for punishment, I guess. But yeah, but that is a good point, and you're not the first to bring that up. And that's something we really have to wrestle with when we consider these applicants, because they're dealing with financial matters, they're dealing with HR issues, and it does put them in a challenging, difficult position. But again, knowledge of healthcare, I think, is a pretty important quality on a board. And of course, there's other qualities, financial background, connection to the community, and things like that. But point well taken. Yeah. Yes. Nurses are, yeah, we do not discriminate against any hospital staff. Yeah. Okay. All right. Any other questions?
I'm Vice Chief of Staff, and Maria Cornelius is Chief of Staff, and she's out of town, so yeah, she asked about.
Yeah, we have a medical executive committee that consists of three physicians that are part of the board, or are on a advisory position with the board. So, okay. Any other questions before we move forward to approve the February financials? Any board members that would like to add anything at this point? MCHD? Okay, good. All right, do I hear a motion that we approve the February financials that were recommended last Thursday for approval by the Financial Committee?
I so moved.
Okay, do I hear a second by Shirley? All those in favor? Aye. Aye. Any opposed? Okay, motion passes. Okay. All right, I'd like to move on to the CEO report. And again, that would be Tony.
Okay, just a few updates. Actually, I mentioned a few things on my list in the previous, but April 24th, we're actually kicking off our Just Culture implementation. David Marks will be in town working with the board and working with the senior leadership team to get that started that day. We currently have our employee engagement survey going on as of 3/20. Let's see, this was as of last 3/22. I believe we had 53% response rate on that overall. We were hoping closer to 70, so maybe we'll pick up a little bit in this week. A couple other items. We have scheduled the closing on our Dolores building for April the 5th. So we'll be, as we mentioned before, we actually did get a contract and sold that piece of property. We're working on the sale of the annex building and hope to have that one completed sometimes during the month of April also. Let's see, in recruitment, I mentioned Dr. Lanningham. We also have a new CRNA that'll be starting in early summer. Do we have an exact date on that yet?
It'll be June 17th.
June the 17th, okay. We have Melissa Sims, a nurse practitioner, starts in June. We've had some locum providers working in our ED. We had some transition there, but we've been filling in until we get some permanent replacement. We also have our audit, annual audit going on this during the last month or so. We actually expect to have an audit report during the month of April, which will be a significant improvement on what we've seen in the previous years. So we're moving along with that one. Karen, would you like to talk about the HCAP scores?
So we do CMS required HCAP scores.
Yep. You'll have to turn on the microphone too. Green means go.
So we do the CMS HCAP scores for our inpatient unit that's required. There's 17 required questions. And the one that we picked out to work with is would you recommend? And we set that as our goal for our staff. And our would you recommend is at 76.47%, which is the highest it's been in the last 6 years. So we're very excited about that.
Can you explain a little more what HCAPs?
Okay. It's a patient satisfaction score, and we ask the patient to take the survey when they are discharged from the hospital. It's for inpatients who are discharged home, receive a call or a letter asking them to fill out this survey. And there's 8 domains, I guess you would say. They're around nursing questions, doctor's questions, was your bathroom kept clean, did we help you to the bathroom, those kind of questions. And then the last 2 are would you recommend, and then rate your hospital stay. And the would you recommend is really your confidence score in the hospital. So we're really happy that that's going up and that people are really building confidence in us. We also do a CGCAP score, which is not required, but we do it for our physician practices. And that's where you will receive a letter or a call asking you to fill out a survey about your doctor's office visit. And we chose the would you recommend for that as well. And the score for this quarter is 82.2%, which is, it's ran pretty much in that range for the last 6 years. So that's really a good score as well. Then we do a CAPS average, where you take those two would you recommend scores and average them together, and we're at 79.34%, which we've ranged anywhere in the last 6 years from 73% to 81%, so it's right there in that range as well. That's okay.
76%. First of all, it's a national scoring system.
Correct.
And that 76%, where does that rank you across the percentile for hospitals across the country?
Okay, that's a very good question. So when you look at the HCAP scores, we rate ourselves in domains of 25th percentile, 50th, 75th percentile. And that score of 76.47% would be in the 75th percentile. So we're in the top quartile of hospitals when you compare us to other hospitals in the nation. So that's a very good score, and it just indicates, you know, how well we're doing. And I have to brag because the nursing score, we have 3 questions that are asked about nurses, and our score for this quarter so far is 91.53%, which is in the top 25%. I'm very proud because I think our nurses do a great job, and that's the highest score they've received in quite a long time. So thank you for taking great care of our patients.
Karen, in looking at the trend since 2018, and obviously there was a lot going on in 2018, what's happened to our scores since then?
Well, our scores have gone up dramatically. So I ran it for the last actually 6 quarters. And our scores total for the whole 17 questions have improved dramatically this quarter. So I think that says a lot about us putting the patients first and really focusing on what we're here to do, which is to take care of our patients. So, thank you.
Do you want to talk a little bit about the train proposal at this point?
If you want to.
Yeah.
Okay.
Yeah.
We've included in the package for review a proposal for train controls. Obviously, we have a very limited capital budget this year. We've been, in our forbearance agreement, we had some restrictions on the amount of capital we could spend, and we've been approved to spend basically about $500,000 in total in capital. It's also been well publicized, the amount of infrastructure issues we have throughout the organization, throughout their buildings. And one of the things that's been identified as a very high priority, and being a priority because the failure or the lack of this system has already resulted in some damage to other areas of the hospital. So we're actually looking to train controls and as putting a trains control system on all of our HVAC system, which allows basically those systems to talk to each other, allows plant ops to control it, because they literally at this point have to go up on the roof and make changes manually to some of our systems to keep them in line in operations. We recently had an instance to where one of the air exchanges shut down on top of over the surgery area. It doesn't talk to the humidifying system, so that system continued to feed water into the air ducts. And as a result, it flooded part of our surgery area, and we were down for a while, and it could actually cause quite a bit of damage in doing that. So we see this as a proposal. It's actually a pretty healthy expenditure. It's about $240,000. We've actually worked with Train to break it up into 4 separate events, so they won't have that major outflow of cash all at once. But it's something we see as a priority. Like I said, it is included in the SSR report as one of the priority items. That's been listed there, and something that we see as something that needs to be done pretty quickly to, again, as a preventative measure to help us know what's actually going on with our systems. So, Dean, do you want to add anything to that? You probably know more about the system than I do.
Yeah, I'm glad to see it going in. So, having personally been on the roofs and done some of that, it was needed. So, I'm glad to see that happening.
If y'all want to look at it, I mean, it's not.
Tony, when do you? I think we want to take a look at it as a board.
Okay.
But when do we need a decision on that? And Dean, I know you want it now, but I'm sorry, we're not probably going to get there right now. But I think what we'd like to do, I think as a board, is discuss
Oh, absolutely.
Discuss it more. Not everyone is familiar with the SSR report, which to the audience is an engineering report that discusses a fair amount of the infrastructure upgrades that the hospital's in need of. But I think we need to act on it pretty quickly, but that's something that we probably need to discuss.
Yeah, absolutely. We can take some time.
Over the next month.
Right.
Please.
There you go.
I wanted to mention, too, that on the DOLA grant, we're asking that we wanted to find out if we could get other partners that would make that grant stronger. And SHS has stepped forward with a commitment to do so. So we're partnering with them, as well as the foundation board has also approved some funds to be put into that. So when the DOLA heads look at this, they're going to see that there's just not MCHD asking for this, it's a partnership, so that'll make it stronger. We thank you. You're going to make a decision on that?
Yeah, we'll entertain that when we get into the consent agenda.
Sounds good.
Yeah, which we'll do, I think, after our next discussion, unless there's any discussion from the board at this point on the issues thus far. Okay. What I'd like to do, maybe, Dean, is have you discuss a little bit about the facilities committee. And for folks in the crowd, in the past, the MCHD board and the SHS board fielded a facilities committee that was overseeing a lot of the construction. And once construction got done, we needed a new mission, which we have now, which is additional infrastructure needs in the hospital. So I'm going to hand it off to you, Dean, to talk more about the facilities committee and our next steps there as it ties into the DOLA grant proposal.
So at this point, we're applying for a April DOLA grant, which we're hoping that we'll be awarded that in July. And once that starts, then we can start our design work, which would be complete. I've asked them to have that complete by the 1st of December, which would put us eligible to go for a construction DOLA grant in December. And we would hope to get that awarded sometime in, I think it's March or April. So we would start to do our facilities improvements on those tiers, on our 3 tiers, about a year from now. And that's roughly a $10 million venture. Unless something else comes up that we're not aware of, that would have to be handled sooner. So that's kind of where we are. The facilities committee is right now comprised of 4 people, me and Jay, Tom, and
Cody.
Cody, okay. Yeah. I didn't know you were on the facilities committee, Cody. Yeah. So we'll be, once we start that process and we get that design process going, then we'll be meeting pretty regular to get that moving forward, and we'll funnel all that through the facilities committee, and then we'll start construction from that point on. So, are there any questions about the improvements? Get them done.
And just to clarify again, when would you like, when do we need to meet? Obviously, we need to meet before December as a committee.
I would imagine we'd have a couple of meetings once we get started on the design, because Davis will want to meet with us to make sure we have design, if we have any design issues. So probably, I would think we'd have a meeting to review that design probably in July or August.
Okay, all right.
Yeah.
We should know on the Tier 1 grant by the end of May, 1st of June.
End of May, 1st of June.
Yep, so DOLA grant is submitted next on the 1st, by the 1st, and then a quick turnaround. Okay. Yeah. Behind
the scenes, we've had the engineering group and our architect working on it for the last couple months to get us some estimates and design, preliminary design, so we know where we're headed on those improvements. So when we can go, we'll hit the ground running and hopefully have it fixed in a short period of time, meaning the next 5 years.
Yeah. Before it goes up another $1 million.
Yeah, well, it's going to take time, so.
Yeah, okay. Any questions on that from the crowd out here? Okay. Boards, any additions on the facilities discussion whatsoever? Okay, I would like to go on to the consent agenda. We've got a number of issues that we need to, or motions that we need to address here. I'd like to add one more, which would be a committee position. First, I'd like to hear a motion for the approval of the February 27th, 2019 minutes. Is there any discussion or changes to those minutes from any of the SHS board's members? Okay. Do I hear a motion to approve the February 27, 2019 meeting minutes?
I so move.
I second.
All right. All those in favor?
Aye.
Okay. Okay. Tony, can you expand on Resolution 2019-03, which is the, let me quick get to it, the requirement of the Centers for Medicaid and Medicare Services to have a delegated authorized official from SHS as a signature on that. I've got it right here.
Okay, yeah, basically, as it says, the SMS requires that there be somebody designated within the organization to act as the official for the organization. I'm actually currently only authorized, right?
Okay.
It's just actually adding Rick.
Adding Rick
as
to
an
it.
additional-
Okay.
yeah,
Okay.
that's what-
All right. All right, do I hear a motion to approve Resolution 2019-03? Okay.
I'll second.
Okay, all those in favor?
Aye.
Any opposed? All right, passes. Okay, the second resolution, 2019-04. This ties into the discussion we had about the DOLA grant. I'm sure many of you have dealt with grants in the past, and that partnerships are a key to the success of those grants. MCHD is working on a DOLA grant to the tune of $200,000, and as Brad and Dean mentioned, the Southwest Memorial Health Foundation has agreed to support that grant with additional funds. And I would like to make a motion that the Southwest Health System Board and the Southwest Health System, Inc. Provide $20,000 in partnership dollars to support this planning grant, as well as to show support that the SHS system has behind this DOLA grant. So I could probably trim that motion down a little bit, but let me rephrase that. I'd like to make a motion that SHS Board pledges $20,000 towards the DOLA grant as partnership dollars. And do we like to discuss it all, board members? No discussion? Okay. Do I hear a second?
You're approving resolution 2019-04.
Did I say 03? Okay, okay, thank you. Do I need, okay. Let me rephrase that we would like to hear a motion to approve resolution 2019-04. Okay, is there a second?
I second.
Okay, all those in favor?
Aye.
Aye, any opposed? None. Okay. Okay, right now we're lacking a vice chairman. I would like to make a motion to appoint Cody Burke as vice chair of the Southwest Health System Board of Directors. Do I hear a motion? Do I hear a second? I'm sorry. Do I hear?
I so move.
I hear a motion, okay. Is there a second?
I second.
Okay. All those in favor? Aye. Any opposed? And you're recusing yourself? Okay, all right. Okay, thank you, Cody, for stepping up to the plate there. Okay. Okay, Tony, have we missed anything here?
I don't believe so.
Bridget?
You're looking good.
You've kept us on track here? Okay. I'd like to take an opportunity to entertain any more questions from our visitors tonight before we move into executive session. Are there any questions, any comments from anybody in the audience? Okay. Once again, I appreciate everybody showing up tonight. We'll be adjourning into an executive session, and I'm not quite sure how long we will be here in executive session. People are welcome to return later on this evening. If not, thank you so much for joining us, and appreciate your support of the hospital. I'd like to take about a 5-minute break here.
I need to adjourn.
Oh, I'm sorry. Yeah.
That's right. Do I hear a motion to adjourn the MSHD? Second? Those, Fred, motion, Rob, second. Oh, yeah. I'm sorry, Jay made the motion. And Rob seconded. Those in favor? Aye. Opposed? Thank you.
All right.
That makes more sense to you.